Howdy, everybody. Thanks for joining. We're going to get things started here now that we have most everybody. We are here now to kick off our programming contest. Specifically, this is our FHIR and Digital Health Interoperability contest. So I'm going to go ahead and share my screen here so we can take a look at some of the rules. Great. Okay, awesome. So we are going to be running this contest from May 12th, which is today. This is the kickoff, all the way up through June 1st. We have a prize pool of $12,000 for first place, second place, etc. We'll go over those categories in a minute. I wanted to chat about the topic first, and we have a guest speaker here who can help touch a little bit more on the details there. But the topic for this programming contest is we're essentially asking you to develop any interoperability solution, ideally using FHIR or just more general healthcare interoperability. Anything that helps to develop these systems, maintain them, that are using InterSystems IRIS for Health, Health Connect, or the FHIR server. So before we get into things, let's go over some general requirements. These are going to be familiar to you if you have participated before in these programming contests, but we'll go over them all the same. This application has to be fully functional. It can't just be an import of something in another language. We really want to see these kind of fully fledged solutions. They don't have to be fully production. They can be MVPs or proofs of concept, but we want them to be functional. We're also accepting any OpenExchange apps that are new. This can be a new addition to the OpenExchange. It can also be an existing OpenExchange application if there's been kind of significant improvement and iteration as a part of this contest. The application should work with IRIS Community Edition or IRIS Health Community Edition, IRIS for Health Community Edition. It doesn't have to be a specific type. It can be installed locally on Windows or Mac. It can be in a Docker container. That part doesn't matter, but we want it to work with Community Edition so that the broadest number of people can try it out and benefit. It should be open sourced, so we want to make sure that anybody can use this and adapt it and experiment with it. And we want it published to GitHub or GitLab or some other source control like hosting site. It should have a README, so we know what it does. We want people to be able to understand how to use it and install it. This should be in English, and it can optionally contain a video demo or just a description of how the application works more broadly. And as a developer, you are allowed to participate with multiple submissions if you have tons of amazing ideas for how to use the FHIR server to make data more interoperable. But we ask that you only submit a maximum of 3. We're only going to really allow folks individually to submit at most 3. So into the prizes, like I said, we have a prize pool of $12,000 total, which is great. And we have 2 categories. Again, they're going to be familiar to you if you participated before. There's the experts nomination. These are prizes where a panel of experts here at InterSystems are going to review these submissions. They're going to pick the ones that they think are most powerful or innovative or fun. There's all sorts of criteria here, and we will determine a ranking from first place down to 6th place, and we can see the prizes here. $5,000 for first place, $2,500 for second place, and continuing on down until you get to 10th place. So lots of folks are going to receive prizes. The second category here is our community winners. So these are not directly correlated with our experts. These are all voted by you and other members of the community. You can pick your favorites. You can pick the one you think is most useful or powerful. And those will also receive prizes that you can see in the listing here. 2 notes on this point. If a lot of participants or if a few participants receive like the identical number of votes, we're going to consider them tied for that, and they will share the money among the winners. And then obviously we can only grant cash prizes to folks who verify their identity. Organizers will reach out to you. We'll deal with all of that after the contest. We want to make sure that we know who you are. And in terms of participating, anybody who is a developer community member can participate. That is probably a lot of you watching this right now, but if you're not a member, you can create an account to the developer community and you can participate in the programming contest. One notable exception, folks like us who work for InterSystems, we are sadly excluded, but contractors are allowed to participate and anybody else. And you can also participate as a team. So if you and some friends have a really good idea or a project that you've been working on in this space, you all can submit in teams of between 2 and 5, ideally not a team of 10 or 20, but teams of 2 to 5 are also allowed to submit. And before we get into the topic, I just want to go over the deadlines one more time in more detail. The application development phase is going to start today with the kickoff, May 12th, and will continue till roughly the end of May, the 25th. So that is the deadline for submissions. Should have your application and your README and all of that sorted and submitted for the contest by the 25th. The next day on the 26th, we'll begin the voting period. So this is where our panel of experts are going to test them, run them, review them, and vote. And we're going to determine the top 10 places in the contest. That's going to continue from May 26th until June 1st. So the end of the month is going to be the end of the voting period. Important note here, you can continue to improve and iterate if you have tweaks to make or updates to the README. You can do that up to the end of the voting period. I would encourage folks to keep in mind that judges are going to be reviewing and casting their votes throughout that period. So if you have last minute changes that you make the very end of May at like midnight, we might not see those. So try and get everything pretty buttoned up by the time they're submitted by the 25th. We have a bunch of resources here that are all going to be really helpful for this topic. But before we continue any further here, I'm going to kick it over to Elijah, who's going to discuss a little bit more about FHIR interoperability, Health Connect interoperability, and just the topic in general.
Great, thanks, Derek. So I'm Elijah. I'm the product manager for FHIR, so working across IRIS for Health and the FHIR server. I'm based out of Boston. Nice to sort of see everyone. I've got a few materials here to share, but I guess to sort of give you maybe a quick high-level view. I'm not sure what the sort of experience levels are necessarily with FHIR. We obviously have a lot of developers who have a lot of healthcare experience, but aren't necessarily too involved with the spec in any depth. FHIR is really an exchange sort of set of standards that has had sort of quite impressive adoption, particularly in the US and across Europe. So despite only really being introduced in 2014, it now plays sort of a quite an intrinsic role in a lot of US healthcare regulation, for example. So we're seeing EHR vendors having sort of mandatory FHIR API support, and a lot of sort of certification processes in the US rely on FHIR interoperability as well. So it's sort of we're seeing a lot of sort of quite explosive growth, I guess. And what I sort of want to walk you through is how that really impacts, I guess, third-party developers and sort of healthcare providers, especially. Those are sort of the two markets that we look at most. And really what we've seen from this is this, quite impressive, I guess, opening, particularly of EHRs to third-party development. So I will quickly share a presentation. If I go to this slide here, a lot of you may have heard of Smart on FHIR. Really what you need to know is that the S stands for substitutable and the R stands for reusable. So the idea with Smart on FHIR is developing an application should be sort of a highly reusable process directly on top of FHIR. So this spec, I think it was first really introduced actually in Boston in 2010, but it sort of became linked to FHIR around 2013. And what this really aims to do is provide sort of an application framework that allows you to sort of build once and run anywhere, assuming that the sort of source applications support the Smart on FHIR standard. But in particular, what this sort of allows for is third-party application development to really hook into health systems across the US and quite a few places in Europe as well where this is supported, and to sort of leverage modern development frameworks directly on top of these health systems to then build sort of patient-facing or clinician-facing applications. And we'll sort of talk through some of the use cases there as well. But I think just to get a sense of this timeline here, this is all pretty recent. Um, 2013 being sort of the formalization of Smart on FHIR, or as in the Smart framework with FHIR, is extremely recent. And if we fast forward to sort of the 2020s here, we can see that actually this spec is now an intrinsic part of sort of federal regulation in the US. So we expect every health system to sort of support at least a subset of these APIs, but in reality, what we're seeing is that actually this is how a lot of healthcare providers are starting to distinguish themselves as well, particularly in the digital space. So being able to build sort of highly effective applications, particularly for patients or for sort of clinical decision support. What this is really sort of pushing for is sort of more patient-facing innovation in particular. So guaranteeing secure and fast access to your data, and also trying to sort of reduce administrative burden by sort of digitizing a lot of the sort of support and decision systems that are currently built. But yeah, for those of you that aren't familiar with this sort of framework, I'd strongly recommend checking out the Smart Health IT page. They have a ton of information. They have links to test environments. They have vendor sandboxes. So these are provided by EHR vendors, for example, Epic, Cerner, Athena. They all have some great sandboxes that you can actually leverage to try and build some applications. And then also, common data sources like Cynthia, or a few GitHub repos that might be worth using. In terms of what this really means, what is the motivation for this? It's quite simple, really. Any single health system can't provide as many applications as you would like. So the goal with Smart on FHIR really is, how do we open up this sort of arena of clinical data or financial or administrative data? How can we sort of try to open up this entire infrastructure of health IT to then allow more specialized developers and smaller teams with maybe more focused goals to then actually try to build best of breed solutions on top of these clinical repositories, for example. So I'll sort of walk through three main categories of use cases that we see. The first one is what we call patient engagement. So these are applications that you might actually find on the App Store, for example, or the Android Store. These may be iOS apps, they may be sort of desktop apps, but these are typically revolving around how do we get patients fast, simplified access to their data, and how do we effectively give as much control as we can to a patient throughout the care process. So these might be patient portals. I think everyone here is probably familiar with MyChart or some equivalent. But we're also seeing more innovative use cases. So smart health cards is a particularly exciting case where people can effectively build digital passports of vaccination records or immunizations, that sort of thing. We're seeing applications around medication tracking and self-care. So particularly for older patients who may have a large number of medications to deal with and prescriptions and sort of schedules they need to run on, being able to have very sort of clean, simplified interfaces to try to manage this and try to get advice from clinicians directly is an exciting market. The second sort of, I guess, vertical that we would look at is a clinical decision. So this is actually clinician facing instead of patient facing, and this is more around how can we try to maybe chart patient data a bit better for a primary care provider who maybe has to deal with dozens of patients daily, and previously has to spend God knows how much time sifting through 30 pages of medical documents, care management summaries, but also symptomatic detection. So we're seeing self-reported symptoms that maybe come directly from a patient portal or a patient app. How can a clinician try to triage these cases more effectively? How can they rely on previous cases within the health system to maybe try to get some insight? And then medical summaries and risk evaluation. Again, there are quite a few sample applications. Again, that link that I posted on Smart Health IT, they actually have a whole health gallery that you can take a look at. So some of these applications, what you're seeing on the left-hand side here, you can try to drill down into these and maybe try to launch some of them yourself. But yeah, this is a particularly exciting area for decision support. And then finally, population health. So I'd say this is probably the most nascent of the three. You know, it's not as well defined, perhaps, as the other two, but you know what we're seeing here is more around, you know, how can we try to analyze entire cohorts of patients? How can we try to build risk calculators and then drill down based on certain you know, sort of dimensions of this data? There are definitely use cases within clinical trials, for example, where you're monitoring, you know, entire bodies of patients throughout you know, a few different stages of trialing. And then also disease management, which is, I'd say, a disappointingly underdeveloped area currently, given the pandemic that we've all emerged from fairly recently. But yeah, I'd say population health is an incredibly interesting area as well. And it provides a slightly different set of challenges because you're dealing with a lot of what is quite consistently unstructured data within EHRs as well. So, you know, there are definitely some challenges here in terms of the data engineering required to get sort of high quality cohort level, you know, bulk data sets. But I think what this sort of brings us to then is, you know, what does InterSystems actually provide, and, you know, what's the kind of platform that you can try to develop with? So everything you're sort of seeing here, this bubble in the middle, this is kind of my you know, bird's eye view. You know, what do we provide within our FHIR server? So particularly what I want to illustrate is that at our core, you know, we are a high performance database, specially designed for FHIR resources. So for those of you that have worked with FHIR, you'll know that it's typically stored in JSON, sometimes XML. That does not lend itself very well to a typical relational database. So what we have is obviously a very specialized data store that can handle that, and then, you know, natively surface it in a few different ways. One thing that's particularly interesting on the left-hand side is what we call bulk FHIR. So this is how we actually connect to source systems. It could be an EHR, it could be a research database, it could be an immunization server. They're particularly good because they have often quite complete records regionally of patient data sets. And what we have is this sort of bulk FHIR coordinator, is what we call it. So what this can do is actually sort of hook into these source systems and asynchronously kick off sort of a large-scale data pull directly into the repository. So we have, you know, scheduling and data quality checks built into that. But, you know, we would highly sort of recommend you trying to leverage that, particularly if you're looking to work at scale with this sort of thing. And we do have some recommendations in terms of how to sort of connect this natively to EHRs, you know, over smart, over like the Smart on FHIR sort of auth-flow, for example. There's some documentation around that. On the right-hand side, we have what we call FHIR SQL or FHIR SQL. And what this does is, even though I just said FHIR is natively sort of a document structure, what we can do is actually provide a relational modeling tool. So what this does is it actually allows you to specify with you know, simplified expressions how you want to project this data into a table. And then you can hook in your BI tools. You can hook in you know, any sort of spreadsheet tooling, for example, or you know, Python applications that you want to then query this over JDBC. So again, this is sort of a highly you know, customized tool that's designed to work with this FHIR database. And I'd say, you know, any kind of analytics that you're trying to look at, or any sort of, you know, BI that you want to run, maybe that's sort of operational analytics, if you want to look at bed usage, or maybe clinical analytics, if you want to sort of track cohorts. You know, FHIR SQL does sort of lend itself to that. And then within sort of the core server itself, we have profile management. FHIR profiles, these are effectively definitions to, you know, better shape the data to a particular use case. So we see, you know, federal governments all around the world, they often provide sort of a national core profile. So these, you know, you may be familiar with US core or UK core, French core, that sort of thing. What these do is they sort of provide these definitional resources for, you know, what elements might be required within, you know, sort of a national standard. Are there sort of extensions? Are there custom elements that are necessary, depending on how the health system is effectively structured in that country? Different countries have different ways of handling insurance, for example, so they will often have different extensions or different resources that try to reflect that. So having profile management is extremely important for being able to try to actually manage those sort of specs. And then sort of the crowning jewel of this is what we call search and operations, right? So what this is sort of a highly optimized set of APIs for actually querying the database directly. So FHIR is a sort of a RESTful standard. Everything on the left and the right is really sort of quite heavily customized to what InterSystem customers want. But this sort of search layer is entirely REST-based, and this we obviously have documentation for what exactly is supported within this. But this is where we see a lot of core application development, and this is really where Smart on FHIR comes into play. So we would expect a lot of client applications to be hitting these endpoints directly. And sort of the Smart on FHIR spec in particular defines the correct auth flows and the scopes that we can then validate within the server. So yeah, there's a lot of depth there, and certainly I'll take any questions about this afterwards. But yeah, just to sort of recap, I'd say definitely check out these docs for sort of more information on sandbox environments, data sets, that sort of thing. And then 3 of the use cases that we're seeing most: patient engagement, clinical decisions, and population health. I think all 3 of these are extremely valuable, and we get a lot of activity in them. That's it for my sort of initial presentation. So yeah, Derek, over to you.
Awesome. Yeah, thank you, Elijah. That was super helpful. I particularly want to emphasize the page that Elijah was just on, demonstrating the sample data repositories and things. That kind of stuff, as you all know, is so helpful when you are implementing a solution. Highly recommend checking it out. If it's not already, I will make sure that it is in our list of resources and documentation on the community so that you can easily find that. Awesome. Thank you, Elijah. I'm going to go ahead and throw it over to Evgeny. Evgeny, if you want to chat about the bonuses for this round, that'd be awesome.
Sure. Hi, everyone. And as on every contest that we have on Open Exchange, we have bonuses, like what we call them technology bonuses. Actually, these are the bonuses that will give your application, your submission, a benefit in voting, like, and put you closer to the money prizes and to like winning positions. And let's go through these bonuses. What is this? So the main approach is to how we give these bonuses and what's the idea. So of course they are related to the contest, to the topic of the contest. So we definitely will give up bonuses if you implement InterSystems FHIR server, if you leverage digital health interoperability productions, yeah. But also we encourage you to leverage Docker. Because Docker always is very helpful for everyone, like to collaborate and also to easily test your solution, your project, and also IPM and things like that. So let's go. I will share my screen and we'll go through them one by one. Can I see my screen? Yeah, perfect. Yes, this is the full set of bonuses we have introduced for this contest. You will find them on if you open contest page on the developer community, and then just click through. So it's maybe I lost internet. I don't know. So, but anyway, so I will go through here. So, but anyway, so it is connected to other contest-related announcements on developer community, and also we will share this link in the Discord and on Open Exchange. So, what are the bonuses? First, as I said, you can collect three points if you leverage InterSystems FHIR server, either within InterSystems IRIS for health or via cloud FHIR server. Second is digital health interoperability. Yes, so please build digital health interoperability productions with your solutions, and this will give you 4 points more. Another option is vector search. Vector search is a technology introduced in InterSystems IRIS and IRIS for Health that gives you ability to vectorize data, and so if you use it for any like rec scenarios or nearest neighbor scenarios, so this will give you 3 points more. Since the InterSystems IRIS can work along with like can be a backend for different kind of LLMs and leveraging LangChain libraries. There's a bunch of examples. So if you leverage this, you can collect 2 points more. This also refers to embedded Python. The Python became a first-class citizen language for development within InterSystems IRIS and IRIS for Health. So feel free to use it, but we want like to advertise this shiny opportunity to leverage Python with the InterSystems data platform. Please do this, and this will give you 2 more points. And as I mentioned, there is also benefits for leveraging Docker, IPM package deployment. So if you can package your solution as an IPM, and this will give you 2 extra points. Of course, it's always great to see the solution that have a demo. So we encourage you to do this, and this also will give you 2 extra points. With InterSystems ecosystem, we have Ideas Portal. This is here, so you can find it here. And Ideas Portal contains a set of ideas, and we provide a link that leverages that is related to FHIR. And amongst all the community opportunities. Implement this idea that is a community opportunity and is related to the topic of the contest, and this will give you 4 extra points. Why we think this is important? Because ideas are being introduced by community members when it is something that is very helpful to the community to drive the technology. And so if you're able to implement this is beneficial not only to you, but to the whole community and of developers. So this is a quite fair addition to support your application. We encourage you to not to shy, but share bugs if you find this. So we set up to GitHub repositories where you can submit a bug found as a form of issue. This will give you 2 points. Don't be very focused on this. So if we give only you give points only for the first found bug for digital health interoperability, and 2 points more for FHIR. We want you, we will be glad to see you submit it, but you be focused on development, not like on a bug bounty. And we encouraged you to share your solution, what you did, any instructions on developer community in the form of articles. So this is 2 points for the first article, 1 point more for the second article. Also, record a screencast and publish it on YouTube. This will give you 3 points more. And we always very welcome new contributors and first time contributing to Open Exchange contest. It will give you 3 points handicap. Yes, don't hesitate to ask any questions in the chat, and Yeah, so how to stop sharing? Yeah. And on the community and in Discord, yes, and if you have any questions in the comments to this bonus page. But with this, I think this is a pretty good set of development sugar, if we may. Yeah, I don't know.
No, that's perfect. Yeah, I appreciate, Evgeny, the emphasis on you can get a bonus if you find a bug, but try not to spend all your time hunting for bugs because then your app might suffer. So
Exactly.
great
Yeah.
advice in general. Awesome. So I think that pretty much covers everything. As a reminder, the dates here are today, the 12th is the beginning of the contest. The deadline for submissions is the 25th of May. So make sure that you get all your coding, all your programming, all your testing done before that point. And then the judging period will be from then until June 1st. So yeah, with that, unless anybody else has anything, thanks all for joining and good luck.